Hello there. My name is Marcy Zwelling. I live in Long Beach, California, and I am my patient's doctor. This video YouTube is intended for every congressperson, senator, or House member who will be voting on healthcare legislation in 2010. It's March 2010. Who would have thought that we'd still be talking about healthcare reform? I had hopes that the legislation, with the help of the working physicians in this country and our patients, knowing what we needed to take care of our patients, knowing what our patients needed, a means to affordable and accessible care, that with those things in mind, that Congress would be able to come up with good legislation to reform healthcare into the 21st century. Unfortunately, that hasn't happened. Lobbyists are involved, politics is involved. We all get it, we understand. But now it's time for you to do your job. Now it's time for you to dig deep. Understand your principles. Understand that you work for us. The American public says no. Stop. Let's start over. Let's be sensible. This is the advice that you give to your children. This is the advice that your parents gave to you. It was always about morality. It was about principles. Certainly, we all have ideologies. We all want to move things forward, and many of us come from different biases, different places. But in this case, every American wants affordable and accessible health care. Doctors want to be able to work for patients in a marketplace that's transparent and open, where we can work with them openly and willingly to find what's best for them, find their better day. This legislation does not do that. You owe it to your constituents, you owe it to yourself to vote on principle. Vote no on this legislation. My life is not about politics. Neither is your mother's, neither is your children's. It's time that we get down to the brass tacks here and do what's right for this country. Moving forward, vote no today, but let's work together as we move forward in the 21st century on good legislation. Smaller pieces, one thing at a time, where we could prove that things are working, and then we'll move to the next step. That's what I do every day, and I know that's how you conduct your life. This legislation should not be any different. Thank you very much for listening. And once again, your constituents, the doctors of this country, our patients, my colleagues, are asking for you to vote principle. Vote no on the current healthcare legislation and help us start over and write something together that works for all America. Thank you for listening. Bye-bye.